When my son was about 6 weeks old, the doctor made the decision to put me in the hospital, and I was there for a month.
Wow.
On IV steroids, clear liquid diet, visitors, of course, thank goodness, and just, no food, because any food would just tear right through me.
Classic.
And anyone who's out there listening, who's got a case of ulcerative colitis, knows that that's probably one of the worst things, is that you can't eat for comfort.
Anything with fiber, you're going to tear you up.
Anything. It was just anything. I couldn't eat meat. I couldn't eat anything with fiber. At this point, it was totally a clear liquid diet.
I was just asked the other day by someone new to us if I was the forbidden doctor. Well, of course, I said no. The forbidden doctor is not me at all.
We are not the forbidden doctor. Jack is not the forbidden doctor. It's in you.
The forbidden doctor is that magical, mystical power inside of you that is controlling and healing
It's
everything.
that beautiful, marvelous, almost miraculous force that controls all healing.
It's that innate intelligence, that life force-directed influence that triggered your DNA to guide the building of your body after conception.
Yeah, it's that power that sustains your life, repairs your wounds and lesions, and it never stops working. It's that essential part of you that keeps you alive and heals your every hurt.
This is the forbidden doctor. It's not me. It's that part of you the powers that be have decreed forbidden to ever learn about or even consider, and never ever rely upon. For it is forbidden that you even know this life force exists at all.
You are your own forbidden doctor.
Yes. Hey everybody, it's Dr. Jack.
And Mary.
And welcome back to the Forbidden Doctor podcast. This is podcast episode 179, Ulcerative Colitis and Forbidden Healing.
Today we're going to talk about some forbidden healing relative to how it's possible for the body to attack itself and be the cause of its own disease. But before we get into that, for our regular listeners, the next 4 minutes is our financial stuff. You can fast forward through it if you choose, but for our new listeners, please listen to it at least once so you understand how we do things around here.
So before we begin this informative and forbidden podcast, we want to take a few minutes to talk about why we do not have sponsors.
Yeah, we've been approached many times to sell different products on our show.
But we've always been compelled to resist these financially tempting offers, because many times they lead to an attempt for editorial control over what we say.
Yeah, and what we're doing here is too important to be controlled by corporate interests. So we never allow this kind of advertising on our show.
And so that said, we don't make money from these podcasts. All of our income comes from your interaction with us and what we have to offer, and from the sale of our Forbidden Doctor products and supplements from the oldest and original whole food supplement manufacturer in the United States, Standard Process.
Yeah.
But we're not paid by Standard Process. Indeed, they distance themselves from open internet promotion because of constant scrutiny from the FDA.
Yeah, and as a result, they do not advertise or pay for advertising outside of a licensed healthcare professional's office.
And the reason for this is really simple, because their products are very powerful and they actually work.
Yeah.
So they need to be careful about people making claims. Others have mentioned that while the knowledge we share can't be found anywhere else, it is often tied to Standard Process.
Yeah, and that also includes our own ageless thyroid and long life energy enzymes products.
Yes, and so you might ask, could not our own products be creating a conflict of interest? Mm-hmm. I mean, have we mistakenly created infomercials instead of free knowledge podcasts?
No, we do this on purpose.
Yes, because years of experience on the radio and in our clinics and almost 500,000 downloads of our podcasts have taught us a few things. And the most important is that the type of nutrient-dense foods that most of us need to get our bodies actually healing from years of malnutrition are not easily integrated into most of our lives.
Yeah, the quest for excellence in nutrition has never been an easy task. Just face it, nobody wants to eat raw liver. But absolutely no one will sign up to eat raw liver daily for 6 months. So we feel therapeutic supplementation is sometimes very critical in the healing process.
Yes, it is. So let us be clear. We talk about standard process because this is how you can get whole foods in a concentrated form that you would never, ever eat on a daily basis.
And the reason we do our podcast this way is because it has saved our lives and countless others that we've worked with over the years.
Yeah, so we sell supplements.
Yeah.
And so we try to give free knowledge away about how nutrition touches every aspect of our lives. And so necessarily these two are going to overlap. But the bottom line is, we may mention supplements that you can get from our website, but the knowledge we share is real. And you can take that with you forever, whether or not you ever buy anything from us.
But you can support us in keeping this podcast on the air with a donation at forbiddendoctor.com/donate.
Yes.
Or if you're ready to take your first steps for your own health, you can join our family by going to our website and taking our free symptom survey.
Now, we understand, we really do, that some of you may feel real hardship with even a modest purchase and cannot afford even a single month's supply of supplements. So please know then, it is completely okay if you do not buy our supplements or financially support our show in any way if you cannot afford to.
Yes. However, there are many ways to support us for free. You can give us a 5-star rating on iTunes. That's easy. Or a thumbs up on YouTube. Wherever you listen to our podcast, just give us a good rating.
Yeah, and if you already support the show, thank you. Truly, thank you. And please know that you are the very reason we fight this good fight. I mean, your support makes this all possible.
So now let's get back to the forbidden information they don't want you to know.
Oh, yeah. So I want to introduce Dr. Chris Taylor and his incomparable wife, Melissa, two of our mentors who makes our practice as successful as it is.
Yeah, you guys, these are the two we go to when we get stuck. I mean, these guys, they're just incredible. They are truly mentors for Standard Process. I mean, that's a real thing, right, Melissa?
Yeah, it is. Thank you so much.
Yeah, you're actually a mentor, but you've been our mentor way before they crowned you the actual mentors. We've just loved what they say. In fact, you are commented on in my book.
I am?
Yeah, you're in the front. You're one of the acknowledgments because you've helped us so much. We love going to Melissa's seminars that you give. And she has an incredible story to tell about basically deadly, and you should have been dead, ulcerative colitis. And wonderful.
And along with her is her also brilliant husband, Dr. Chris, who, and we don't usually do interviews. I think we've done one in the past.
No, we've done two.
We've done 2 out of 178. So
we don't like very many people. We don't have very many friends.
No, nobody likes us. Everybody hates us. You know, I'm going to bang my head against a wall.
No, we were really excited. We had him over for dinner. Jack cooked his amazing salmon, garlic dill.
Delicious. Just call it salmon delicious.
Oh, it was to die for.
All right, so
it was awesome.
We're going to do an interview here for however long it takes on something as serious as ulcerative colitis, and we might touch IBS, we might touch Crohn's, whatever, but we're going to focus on ulcerative colitis because that's the one that is most likely to move towards cancer.
Yeah.
So, Melissa, what I want you to do is just tell your story. I don't care how you tell it. I just want you to tell it. Go back to the earlier parts where, and bring us up to date.
But you were very young too, right?
I was. When I was probably 14 years old, I started having a lot of bouts with diarrhea. And back in those days, antibiotic therapy was super prevalent.
Mm-hmm.
My
Standard
mom was,
of care.
Yeah, my mom was totally mainstream medical. My youngest sister, who was 8 years my junior, had cystic fibrosis. Wow. So if we got a cold, a sniffle, anything like that, we were rushed down to Boston Children's Hospital, checked out by the docs.
And given antibiotics.
Everybody put on antibiotics just to make sure we didn't give anything extra to my sister who had a compromised immune system.
Yes.
And so, that's how life went for us. We were on antibiotics a couple times a year. Mm-hmm. And by the time I was 14, I started having real bouts with diarrhea. If I ate pizza, for example, which every teenage kid eats, right?
Absolutely. That's a staple.
Yeah. I mean, I was literally needed to be within, 10 minutes of a bathroom. Couldn't have dairy products. That stuff all bothered me. So when I went to the pediatrician, they said, well, she just has irritable bowel syndrome, because it was kind of new back then, diagnosing irritable bowel syndrome. And they gave me an elixir, actually, like a bottled elixir, and said, take this after you eat.
It cures everything?
It's going to help your IBS.
What was in it?
What was it?
I have no idea. It was a prescription.
Was it like tarry liquid?
Looked like a cough. It looked like a cough syrup. Yeah, and it had a prescription
isn't
label.
it amazing how we just trust doctors? We don't even know what it is, and we just like glug.
To this day, I don't know what it is, and my mom can't recall because obviously it was years later that everything kind of culminated to a head.
Well, maybe she found out.
Yeah. So so there was that. There was that, and no discussion about like maybe you should stay away from certain things, or let's look at what's going on in your gut.
Never any diet.
Yeah. What does your flora look like? Do you have any overabundance of bacteria? There was no actual research associated.
After they
with
had killed your bacteria for years and years and years.
We have done many podcasts on the gut and the microbiome, so our audience right now is familiar with what you're talking about.
That's great. Yeah, so from there, it just went into, other things, lots of illnesses. I had mycoplasma blood disorder when I was in high school, took a month out of school. I had mono when Doc and I first got married.
She calls her husband Doc. It's so cute.
Why don't you call me that?
Oh, because.
Instead of, hey, you, grass needs cut.
Yeah. Had some mono. That took me out of work for 5 or 6 weeks. All different kinds of just illnesses. Strep throat a couple times a year. Then I was told, you're a carrier for strep throat, so you're just kind of always going to have it.
Yeah.
So there's all those immune compromised types of things were going on right up until I was, 22, 23 years old.
Which we've given such information on strep throat because I used to get it all the time. When we first got married, Jack, you remember I had it all the time?
Yes, I do.
And we found standard process about 2001, I guess it was, and I started on Calamo, which is, acidifies you and is amazing. And I've never had it since. I mean, it wasn't just Calamo, but it was everything. And people don't know this. That's why we do this Forbidden podcast.
Right. I think somebody fixed her atlas, too.
Yeah. Oh, yeah, there's that.
Yeah, there's that.
Yeah. So continue on. Sorry.
Yeah. So, we got married, and a few months later, we decided to start a family. And of course, we were super happy about it. And pregnancy seemed to be going really well. But towards about the 6-month mark, I started having just kind of a lot of diarrhea. And in the morning, having to take 2 or 3 hours to get to work because I was really locked up in the house. By the 3rd trimester, I was having some blood in my stools, and what I would tell the OBGYN, I was having fleshy attachments to my stools. I would tell him all the time, and he'd say, oh, you just have some hemorrhoids, or it's just you ate the wrong thing. Cheese and milk, those are mucus-producing foods.
I mean, it just seems barbaric they don't look to the gut. Well, maybe they do more now. I think they do somewhat. But when you were going through this, it's just stunning.
Oh, no. I mean,
Hippocrates said this 2,300 years ago.
Yeah.
And fleshy attachments he didn't hear that.
I was 25 years old. I didn't know anything about my body. Nothing.
Yeah.
I didn't understand how it worked. I wasn't brought up in that kind of family. And I was eating. When I found out I was pregnant, I was totally 100%. I am going to be the healthiest new mom ever.
Aww.
I used to bring my carrot sticks to work, and I gave up soda cold turkey, and I was a heavy soda drinker. Tons, like maybe 2 liters of Pepsi a day.
Wow.
Yeah, heavy soda.
But probably nobody, you didn't think to eat fat and protein.
No, low-fat diet.
Oh, yeah.
Grew up in a low-fat household.
Yeah.
Lots of soda, no milk because it bothered me. Didn't drink it since I was a kid.
Oh, I'm sure.
So, pretty much it was soda, orange juice, no water.
Yeah.
Because there's plenty of water in orange juice.
Oh, yes, of course.
Just lots of sugar.
Absolutely. So, I was tearing my gut up in a lot of different ways. And then we had the baby, and it was beautiful. It was just beautiful. And I was going to be that mom that was going to breastfeed as long as I possibly could. And we got home from the hospital, and by about the 3rd or 4th day, the baby started not breastfeeding, and I started getting fevers. And I was getting dehydrated, and the diarrhea got really intense. And my husband was really concerned, so he called the OBGYN, and they're like, oh, she's just got a cold, she's just got a fever. No, come on in, let's check things out. Finally, he built me a little bed in the bathtub with pillows in it.
Oh, my goodness.
And said, I couldn't get to the bathroom on time.
Yeah.
So we did that, and he said, it's time to go to the emergency room. So we went to the emergency room, right?
Right.
And the doctor said to my husband, how long has your wife had ulcerative colitis? Like right out of the
Well,
gate.
now, what did they do to determine
gut.
that?
It was a short scope right into the rectum, take a look at the inflamed tissue, and they're like, wow, this is the most acute case of ulcerative colitis we've seen in a really long time. How long has she had it? It was news to me. I had no idea.
And I want to back up just a teeny bit. I thought it was interesting that you said your baby wouldn't nurse off of you. And that is just true through the centuries. A mother that has bad, flora.
A bad gut, the milk is bad,
the
and the baby
milk
won't
is bad,
take it.
and they just...
And the dehydration.
Yeah,
Yeah.
And the dehydration. It was just,
Oh, you're losing fluid like there's no tomorrow.
right. Yeah,
So they tell you, well, this is the worst case of ulcerative colitis
they
we've
did,
seen.
and they knew I had a 3-week-old baby at home, and they were torn up about it, actually. Like we didn't want to take her away from the baby, so we'll send you home with steroids, we'll send you home with immunosuppressant drugs and that kind of thing. And you have to stop breastfeeding right away, of course.
Okay, and this is what just tears me to pieces, and I'm sorry to interrupt again.
No, please
People
do.
get so annoyed. But I'm sorry. If you could have just had, a handful of chlorophyll pearls or ointment and just squeezed it up your butt. I mean, just the years of agony. So all of you out there in podcast land know this. Instead of the steroids, instead of
Mm-hmm.
what was the other thing?
Immunosuppressant
drugs.
Imuran was the one that I was given.
And of course, antibiotics, again, I'm sure. And just a little bit, if you used a whole tube, it would be so worth it. It just blows my mind. Okay, continue on.
Yeah, so
Because it gets worse.
Yeah, it does get worse, unfortunately. So we get home, and I'm trying my best to be a big girl. Postpartum, brand new baby, have to give up breastfeeding, all that stuff. And the drugs are just starting to react, feeling them in my body and feeling all the changes and sensations. And it was uncomfortable with the steroids, high doses, but it wasn't controlling the diarrhea or the blood. I was bleeding so much.
I like the way you say controlling, not curing. They're just trying to control.
Yeah, we just wasn't under control. So when my son was about 6 weeks old, the doctor made the decision to put me in the hospital, and I was there for a month.
Wow.
On IV steroids, clear liquid diet, visitors, of course, thank goodness, and just no food, because any food would just tear right through me.
Classic.
And anyone who's out there listening, who's got a case of ulcerative colitis, knows that that's probably one of the worst things. Is that you can't eat for comfort.
Anything with fiber is going to tear you up.
Anything. It was just anything. I couldn't
Anything.
eat meat. I couldn't eat anything with fiber. At this point, it was totally a clear liquid diet. I got broth, and I got Jell-O.
Well, that's good.
And Werther's candies. That's about all.
Yeah, sugar, that's all you
You didn't
need.
get raw egg shakes. You didn't
Or
get
that-
Mary's
Nothing.
milkshake.
Nothing.
Yeah.
I couldn't eat anything.
But broth, I'm impressed.
They used to give her a little lollipop thing with a sponge on it that was flavored, and she would suck on the sponge, and that was like
Yeah.
a treat for her.
Yeah, I remembered that when I was in the hospital having C-sections. But
Jeez.
So they did release me after almost a month, and I had to go home with some IV
Well, were
therapy.
you better off at the end of a month?
Yes, I was. The bleeding was getting under control. The diarrhea was getting under control. With high doses of IV steroids, obviously, I was getting all the changes that occur: the buffalo hump, the jowls in the head, losing hair. I mean, all that was happening. I didn't bring pictures for you guys, but it was a huge change.
she's beautiful
Well,
now,
we
folks.
occasionally we'll have patients in the clinic who've been through months, if not longer, on steroids, and I know exactly the conditions, the body
Well, your
changes.
daughter's been on them.
Oh, yes.
Yeah.
Worse
Yeah.
probably than anything else for me was I looked like I probably had a body that should have been 400 pounds because of the way my face was, but the acne.
I was gonna ask you about your skin.
Forward presenting acne. It was horrible and
that's the
really really hard to face the world with that on top of everything else.
Dr.
If you
Chris,
can't get it out your
I
colon,
want to talk to Dr. Chris for a
come out
second
your
here.
skin.
What was going on with you during this period of time? I mean, how are you handling this?
Day-to-day survival.
You had a new
It
baby.
was tough. Yeah, we were taking care of the
You
new
started
baby.
nursing.
I did not start nursing. Luckily, we had family close by, and they helped us out a lot. But it was tough. I mean, The hardest thing was seeing her go through what she was going through and really not being able to do anything or even knowing what to do to help her out.
Yeah.
All right.
Yeah, we were just married 1 year, 15 months when this.
You were newlyweds. Wow. And young.
Yeah, so it went that way for a bit, and then I got to come home with IVs, and Doc certainly even wasn't a doc back then. He was a PE teacher, and he took great care of me, and awesome. Always was looking for something that was going to make things better, but didn't get better. And when I needed to be weaned off the steroids because of the high risk for cancer, not just colon cancer, but just cancer in general, anywhere in the body. Then I would start to bleed. Anytime I got below 35 milligrams of the steroid that I was on, I would get small amounts of blood. Then I would get down to 20 milligrams, and I would start bleeding heavily again.
Bleeding out your rectum. Mm-hmm. Okay.
Yeah, and sometimes a cup.
Whoa.
Oh, my goodness.
A day. Yeah, just straight blood.
Did you tend towards anemia?
Helped. Oh yeah.
What was your hematocrit? Do you remember?
I don't remember at that time. I was getting blood work every 3 weeks though, because it was just such a concern. Veins blown out, and they had to do the butterfly needles because I had such shrunken veins.
And what year was this?
That would have been 1991 and 1992.
Yeah. Well, Dr. Lee was dead, but standard process was around. This is what is so forbidden. This is what kills me. The agony that you went through.
Well, we were a heavily ingrained medical family because of my sister's disease. Doc's family, his dad was an oral surgeon. So, they lived life out of free samples in their medicine cabinet,
Right.
Nobody that we were intimately involved with had any idea that there was a world beyond medicine.
Yeah, me too. I'm the exact same. I was raised in a complete medical family.
Yeah. So fast forward 6 months, and nothing is better because I'm down on the steroids, the bleeding's occurring, and back in the
So what's your
hospital.
daily activity consist of when you're doing this?
Disability. Total disability. Just having family.
Who's taking care of the baby?
My husband, my
Chris.
family. I'm laying around in bed and sitting on a couch, and they're bringing the baby to me so that I can spend time with him.
Well, that shows you how much your gut health affects your life. Literally, you were just dying.
Yeah,
Yes.
she couldn't leave the house.
I couldn't
Yeah.
leave the house.
Yeah.
And so back in the hospital for a month in New Hampshire, and they didn't know what to do with me. So they discharged me and sent me down to the Leahy Clinic in Massachusetts. And they were going to also discharge me. They told my husband, well, her blood work looks pretty good. But, I was an athlete prior to this. I was a very strong, woman and healthy for the most part. I had all these immune problems, but I was able to somehow constitutionally kind of bring myself up from there. So my blood work looked good, and they said, oh, no, you can go home. We'll just keep an eye on her. He refused.
Good. Good.
Yeah, I said no way. Living with her the way she was and the medical people telling her to just go back to that.
Yeah, because they didn't know what to do.
Yeah, there was no way.
So they admitted me for observation, and within 3 days, they scheduled me for emergency surgery. They said, she's outputting so much blood that we don't know how she's even still, able to get up and walk around. And so, I had
Exploratory surgery to find out where the bleeding?
No, it was right to the gusto. They said her entire large intestine is probably just falling apart with the amount of blood that she's putting out. So went in for an immediate, what they called at the time, an ileoanal anastomosis, which is where they try to save some small intestine to create a rectal pouch for someone so that they can be reconnected down the road once things heal. And so that's what I had. It was supposed to be a temporary ileostomy for a period of time while the body healed. And then after that, After that, then they would reconnect so that I could have an artificial rectal reservoir that would collect bowel movement and be able to go to the bathroom like a normal 27-year-old woman,
At the time, it was like a new procedure, and they were experimenting with it. So when they took off all of her large intestine, 2 feet of the small intestine, they reconstructed. They made it into a pouch. They cut it in half, folded it over.
From the ileum.
From the ileum. And then they took that pouch, sewed it to her rectum, and then bypassed that into a temporary ileostomy to let that heal.
Right.
In hopes that they could...
So how long did you have the ileostomy? We're talking about a bag here.
Yeah. So I still have the ileostomy because that procedure just didn't work. And the reason why it didn't work...
Oh, I'm sorry. Go ahead.
Yeah, the reason why it didn't work is because the autoimmune condition that I had called ulcerative colitis just morphed into other autoimmune conditions.
My goodness.
Yeah, by the time 2 years post first surgery had occurred, where I was hoping at some point in time to be reconnected, I had already had 10 other minor surgeries to correct abscesses in the pouch, to correct fistulas, to correct bleeding from unknown sources, because my immune system was so whacked. It was just...
Melissa, I had no idea. How long have I known you?
A lot of years, yeah.
Yeah, and
10,
I knew this. I'm
15?
sorry, I had to leave and go get the cat. So, but I've heard this story before, and I just wanted to have our listeners...
I'm shocked.
I know. It blows you away, doesn't it? But did they... I must have missed this. Did they take your small intestine and your...
So the rectum, completely gone. The large intestine, all parts, and completely gone. And then
How do you absorb food?
It's most of the absorption's in the small intestines, and I've only lost 2 feet at the bottom, the ileum portion.
So that pouch that they made, which was like an experimental, and they looked at Melissa being 25 years old, and they were like, she's the perfect candidate for this because she's not a 70-year-old person who has to get their colon removed. So they thought it would be really beneficial, but she was in such a dilapidated state that the pouch kept getting infected, and they called it pouchitis.
Wow, that was brilliant. I wonder how long
they kept
took to come up with that.
Pouchitis, and so eventually they ended up removing the pouch.
Yeah. So 2 years later, that 2 feet that I really did need,
that
2 feet that was a pouch had to be basically discarded and detached from the rectal walls where they made this reservoir for me. So that was completely discarded, and then I was given a permanent ileostomy with the ending portion of the ileum that was still left.
All for a little chlorophyll and Zymex.
Yeah.
I mean...
Initially, yeah.
Wow. Initially, like
back
when
I was 14 years old,
yeah,
right?
14.
I mean, if doctors were aware of some of the imbalances that I actually had going on, and I was able to correct those imbalances at that time.
Well, they saw the bleeding. They did some kind of a colonoscopy to some extent. Yeah. They saw how bad the walls of the colon, sigmoidoscopy. Mm-hmm. They saw how bad the walls were. Mm-hmm. They saw how much blood was coming out.
They just took it all out.
I can appreciate their understanding.
It saved my life.
It's going to say, that's right. And at this point, this isn't, well, what do you think, Doc? Gee, I don't know. Let's consult the books. No, you're bleeding to death.
Mm-hmm. No.
So they have to do the normal procedure that anybody would get at this point. They got to stop the bleeding.
Right. And so, 2 years into this, with the second surgery. So the first surgery, you're talking like 19 hours under general anesthesia. With
19 hours.
First surgery. Second one, only 17.
Well, you can get brain damage with 19 hours.
Well, so there was the 19-hour surgery first to make the ilioanal anastomosis. Then there was the second surgery 2 years later, 17 hours, to give me a permanent ileostomy and the other corrective things that they were doing.
Did you zip to the other side and come back?
It was tough coming out of anesthesia, I'll tell you. I did not do well with that. And then in between those two big surgeries, there were about 9 or 10, I don't even remember right now, but 9 or 10 45-minute to 2-hour surgeries to correct infections and fistulas and abscesses and every effort to try and save that 2 feet of small intestines to be a reservoir. So there was a lot of drugs coming into my body.
During dinner, Chris explained to us the fistula that he had to clean out. That was a wonderful dinner conversation, but it's very serious to us. I mean, this, like you said, this was life and death with the doctors. I appreciate that. I'm from a family of doctors. But before they saw the doctor, this is what people don't know. They need to go to a healer. And we don't have healers in the medical profession very much. A little bit here and there. But mostly, they're not trained in it. It's not their fault. It's nothing. It's what they're trained in crisis care, and they did a good job in that. But unfortunately, we don't know the forbidden information.
And that's what happens with crisis care. Crisis care ends because when people who are good at that have done their job, they don't have further answers, right?
Yep.
And so, we're at the second surgery, permanent ileostomy. In between, for any of the audience that's out there dealing with these post-surgical issues, your insides have been manhandled. Everything's in a different place than it was than what you were born with and how you grew up. And so you start getting obstructions when you eat something that isn't breaking down properly. It's painful. You have to be pumped with IVs. You have to be given drugs to relax the smooth muscle so that things will pass through. You vomit. And, you know, it feels like you're going to die.
Oh, yeah.
An obstruction feels like you're going to die. And it's pretty scary.
These happened all the time.
All the time.
The obstructions were awful. Like, she would vomit feces.
Wow.
Because it had no
place to go.
And because we lived in New Hampshire,
stuck.
it was such a rural area, it was a 45-minute drive to get to the Leahy Clinic in Massachusetts. And so I would bring my bags, and we always had a bag packed in the hallway closet. And I would bring Ziploc bags for the trip because I couldn't control the vomiting. And when I got there, they knew to hook me up with IVs right away, roll me into a hallway just for observation. If I could get enough fluids in fast enough, I could clear the obstruction within 24 hours and I could go home.
I am never complaining again.
No.
Yeah. Look at that look on your face.
I am speechless. Chris, what did this do to your marriage, Dr. Chris?
Oh, it made it stronger.
Oh, that's
Definitely.
cool.
I was hoping that was your answer.
Yeah, and it sent us
Oh, this
down a
gave me
path that we
chills.
never thought we would go. So, you know, we look back and it's just our path to go, and that's what happened.
I'm about to burst into tears.
I know. That is... I've heard this story before. It's been a long time.
But it's a little
we
tough.
were-
I mean, you're 3 years married, and your husband has been your caretaker for a majority of that time.
Yeah.
I mean, it takes a while to detach from that relationship and then to build, you know, a real marriage and a real husband and wife relationship from there, because I couldn't rely on him to be my caretaker forever. I had to start to take care of myself again.
Well, then let's go to that. Once you get the permanent ileostomy,
Yeah.
how old were you then?
I was 27.
And then what was the path after that?
So actually, you know, we were so hoping it was going to be the cure, right?
Right.
So what happened from that point in time is once the obstructions kind of worked their way through and I didn't have them any longer,
And how often do you have these?
I was getting them like every time I tried a new food. It was almost like every 10 days to 2 weeks for about 3 or 4 months post-surgical.
But what was your diet that would work?
Well, mostly potatoes and rice and chicken and fish and really well-cooked vegetables so that they were super
Good.
soft.
That was good.
Yeah, that's pretty much what I could handle.
should always be
anything
cooked well.
beyond that would push things. So a lot of the healthy foods that were not in my diet. Yeah. And this was before Vitamixes and things like that. So,
Yeah,
you
so
know.
you didn't do smoothies or...
Melissa, you forgot a lot about that first surgery at the Leahy Clinic.
Of course I did.
So also during that time, they found out she had some weird thyroid disorder called Plummer's disease.
Yeah.
So they ended up radiating her thyroid.
Oh, you're kidding.
Remember, I told you, I mean, when the body can't express itself in its autoimmune condition, it's just going to find a few more to express itself
Yeah,
with.
yeah, yeah.
So they gave her
That's a good
radioactive
point.
iodine. They eliminated her thyroid, so she's been on
Barbarians.
thyroid replacement since she was 25 years old.
Yep.
But in between that time, don't forget, the hyperthyroid disorder I had was really hard to diagnose. So they thought I had a thyroid disorder, and then I didn't have one. But finally, they figured out that I had this weird one called Plummer's disease.
So let's just kill the
But
thyroid.
before that, her
But
symptoms, the doctor said, this is all in her head. They came to me,
Yeah, I'm sure.
and they said to me that, you know, what's going on with your wife is all in her head. We need to send her to a psychologist.
Actually, what they actually said is I didn't want to be a mother, and this was my escape method.
Are you kidding me?
Nope.
Jeez. Did you punch anybody with it?
I believed them
speechless.
because
Oh,
at
you
that point I
did?
was so broken down. I was so lacking confidence.
This reminds me of some of the stuff we've been reading about autism, where they're blaming the autism on the mother because she's rejecting her child.
Yeah.
Oh, my goodness.
So they said, we recommend that you take her to a psychologist and have her evaluated.
You punched him right in the mouth.
Yeah, so that she went to the psychologist. He did a big evaluation, and he came back and said, you guys are completely wrong. There's something wrong with her. And that's what made them dig deeper and to look in Plummer's disease. I mean, I've never even heard of that before, and it's not a common thyroid
I don't think
condition.
I've heard of it.
It's a really
have,
weird
but
hyperthyroid condition.
It's
So-
almost spurts, I guess, is why it was so hard to diagnose.
So also the Imuran that she was on, which was an experimental biologic back then, ended up causing her to have infections in her toenails So at the Leahy Clinic, they took out her intestine, they radiated her thyroid, and they took off all of her toenails. So she has no toenails.
Yeah, you were showing me that today.
They're beautiful.
Yeah. Oh.
Yeah, but during this time, the life was saved, and
Right.
I was very appreciative.
Right.
But
Of course.
at
Yes.
the end of this 2-year period of time, where I get cleared by the psychologist, he says you have to find new surgeons or new medical professionals that can really address your ongoing care, because I had rheumatoid arthritis with positive titers and was diagnosed with fibromyalgia, of course, who wasn't diagnosed with that back in those days that had any kind of chronic illness. And I was confined to a wheelchair for walking more than 50 feet. I didn't have the capability. My muscle mass was gone. My joints were so sore.
You had a 2-year-old child.
So now we've had ulcerative colitis, autoimmune condition, right? We've had a weird, rare thyroid disease, autoimmune condition, and then rheumatoid arthritis, autoimmune condition. So, I'm just racking them up.
You were decomposing while you were alive.
Racking them up.
That's a true story.
Yeah.
I'd have to wheel her around
Yeah.
if we went to the mall or we wanted to go out, even to a restaurant. I'd have to wheel her around in a wheelchair.
Man, and standard process is just standing there in the wings with their
Right?
protomorphogens.
What we didn't know.
Wow. Well, you guys know they're listening.
Yeah. So we got to a point where now I have massive allergies.
Yeah, you think?
Food, environmental. I can't sleep flat in a bed. And so Chris buys me a lazy boy for me to sleep in at night. And I'm just so congested, just everything's running. And his dad, who's an oral surgeon, says, I've got a friend who's an ENT. Why don't I hook you up with him and you go see if there's anything you can do with him? And so I did go see him, and he said, you're not a patient of mine right now, but, I'm treating you like family because of who you are,
Nice.
There's a guy who's not a real doctor over a couple cities from here. I don't really know what he does, but when people who I can't fix go see him, they come back a few months later and they're whole new people. And so I'm just going to recommend that I do nothing at this point.
We're not a real doctor.
Yeah. I do nothing at this point because I don't have any solutions for you to move you forward. And here's his phone number.
Well, that's an honest man.
Yeah, I was lucky to have that
So
card.
who was this person?
He was a naturopathic doctor who had a live blood analysis and hair analysis lab in his little clinic. He was a grandfathered naturopath on top of that. He was a biochemist.
Wow.
And he just wanted to help people. Homeopath. And he did nutrition.
I bet he
herbs.
didn't make a lot of money.
No, he didn't. And he did lay lectures to teach people, about natural medicine. And so we went over there, but it was a 4-month waiting list to get into the not real doctor. Wow. 4-month.
Jay.
So when
all those crazy people.
Yeah, all those
who'd
crazy.
go see a not real doctor. It took you 4 months to get in
But
there.
we got on the waiting list because we had nothing better to do. And he got us in within a few weeks and started, testing my gut. He found out I had Klebsiella pneumonia, which is a hospital-acquired bacteria infection.
Yeah.
He found out all about my gut dysbiosis, massive amounts of food allergies that I had acquired over time. He did an intestinal permeability test on me.
Oh, good.
So he labbed me up.
Got those villi tested and
we
parasites?
got tons of great information. So when he said to me, Melissa, take these Chinese botanicals and lay on your belly on the left-hand side at 3 a.m. with hot water.
And a full moon.
Yeah, I did exactly what he said for me to do.
With Beethoven's Fifth.
Well,
in the
we
background.
make fun of that, but truly, Dr. McBride's always talking about parasites and everything, and you need to go out on a full moon. Truly, that's when you start the
to get rid of the parasites.
Yes, it's a cycle.
Mm-hmm.
Yeah, cycle. I don't know, but anyway, go ahead.
Yeah, so
That's cool. We don't know what we don't know.
We don't know what we don't know. So this was our first introduction to natural medicine, this gentleman that we went to see, this naturopath. And Doc was so taken by everything. It was that moment, and sitting in his office and having him read the results to us and explain to us what each step was going to be for the next year to get me well.
Wow.
And he just started taking lay classes with him, reading about nutrition, reading about homeopathy, understanding what these lab results meant. And as a PE teacher, he had some health background, but it was just became a passion.
That's
I'd say
cool. That was
passion.
the tipping
No, it
point.
was an obsession.
It was an
That's
obsession.
what happened with me.
That's
When the
amazing.
light finally turned on,
Yeah.
I was obsessed.
Yep.
I could not get enough.
2 o'clock in the morning.
I bought books. I read. We sold all of our sports equipment. We sold everything that we didn't need, and we bought healthy food processing. We made all of our food
From
on
scratch.
our own. Bread makers. I mean,
This is before the internet, really. I mean, there was
Yeah.
a modest amount of ability to search anything, and nobody had stores online or anything. So
no.
everything was still done by catalog. Everything we purchased to grind or make or whatever.
Wow.
So, next
I remember
chapter.
those days.
Next chapter, it was about 3 months later. 3 months later, after getting some treatment, and I had some little bit of confidence left. Like I was a very confident young woman, and then this just kind of destroyed everything that I thought about myself and the environment that I was in. But one day, I got in the car for the first time in almost 3 years, and drove a couple towns over, and I bought a bike. And I bought one of those little kid carrier burly things that, in the wheels, that the little wagon kind of things.
pull up behind.
Pull the baby behind.
Pull the baby behind. And when my husband came home from school, he was a teacher and a football coach. I was in our little cul-de-sac, and I was driving the bike, and I was pulling the baby around.
Wow.
And he was blown away. First of all, how
My
did you
goodness.
get that bike?
Yeah.
Well,
put it in
there
your
was
car?
there was a credit card involved.
Better to get forgiveness.
But that was day one of the rest of my life. That was hope restored, and that was confidence starting to
So
build
what did your
again.
daily diet, regimen, natural stuff, supplements, everything?
Yeah.
What were you doing? How did your day begin? What did you do during the day?
Right. So we were doing definitely Chinese botanical herbs.
Okay,
and
good.
in the old format, the little hard, round, dark tablets that you had to take with warm water to help break them down and
They
stuff.
all had numbers. Like she took TCB9, I think, if I remember correctly.
And then-
it was a gut restorative.
And this
thing.
stuff came from China.
That's so
little,
cool.
Little black hard BBs, like you could bounce it on the table.
I
The
also was-
Chinese culture is 5,000 years old. You think they would have figured out a few things between then and now?
and also some, pathogenic killing type stuff. Biocidin is one of the things that I took back then. It was a horrible tasting, bitter purple
yeah.
stuff. But, within the standard process and Medior blinds, there are very, very similar things that I didn't know about
Very
back
nice,
then.
yeah.
So there was that. So there was definitely killing reagents. And I was working with taking in all of the primary nutrients, vitamin C, vitamin A, vitamin E. But I didn't know much about anything glandular. That wasn't even in my repertoire. Definitely killed the diet of anything that wasn't on my eat list. So everything that I had any sensitivity at all, got rid of it, even if it was a mild sensitivity. I was so strict with my diet.
Wow.
I was loyal. I was really loyal to whatever the document said that I should or shouldn't have.
Oh, this
A
sounds
lot
like
of
a good doctor.
probiotics too, though.
a lot of probiotics.
Back then, everyone looked at ulcerative colitis as like a dysbiosis disease. And,
Not
since
an
then we found out really
autoimmune.
the genesis of it is vitamin C deficiency, and it turns into an autoimmune disease.
So here's
Yeah.
the
her background as a kid, bruised easily, got bloody noses all the time.
Oh, my goodness. Just
Saturday
scurvy
morning
everywhere.
So when we
creature
look
double
back,
feature,
yeah, well-
nosebleeds for 2 or 3
Yeah,
hours.
when we look back on it, her problem was
Scurvy.
a scurvy of
probably
the bowel.
from about 6 or 7 years old.
Massive vitamin C, whole food vitamin
Whole
C,
fi-
mind you, not ascorbic
acid.
acid.
No.
Whole food vitamin C deficiency.
Ascorbic acid will not cure scurvy.
No,
No.
it won't.
So there's
And
that.
it wouldn't have fixed her.
And that realization didn't come to us until probably about 8 years ago, 9 years ago, 10 years ago, somewhere in that range. Because post all of these problems, there was still the nosebleeds that would randomly occur. But I had them really bad as a child. There was a ton of broken capillaries and spider veins that I had from teenage to early 20s that I shouldn't have had because
Yeah.
I was a young woman.
Yeah.
I shouldn't have had those things. Tons of that kind of stuff. Gums bleeding.
Yeah.
And then about, 10, 12 years ago, knee pain and joint pain, really kind of debilitating sometimes. It really arthritic feeling in my knees, but I didn't have my arthritis anymore, and I didn't have anything that would indicate that would be there. And so when Doc started doing some reading, we were doing an ulcerative colitis presentation, and this light bulb went on. He found an old book.
From
How old?
1950.
Yeah.
Always has to be before 1950.
That's not that old. That's the year I was born. That's just, a couple decades ago.
It was
The dark
it was called
ages.
something like a postulation of the new genesis of ulcerative colitis, and I found it on Mark Anderson or Saline River Press's historic archives. That's where I found it. I just got on there and I typed in ulcerative colitis, and Philip Norman is the name of the author, MD, and I pulled up the full book, read the whole thing through, and I looked at Melissa and said, "You have, scurvy."
We haven't fixed the problem yet.
You
That's
have
what he said to
scurvy,
me. We haven't
yeah.
fixed you
I mean,
yet.
we've been dumping probiotics into her, since we found this naturopath, because that's how he was addressing it also. And
But probiotics only work while
Right,
you're
while
taking them. They don't cure.
Right.
There was a point where I stopped taking them, and at this point when we discovered this, I wasn't taking anything like that any longer.
So what'd you do it now that you got the book? You read it? What do you do now?
Oh my gosh. I ordered standard process Cataplex C, whole food vitamin C. I took 12 a day, and it was pretty much 6-week mark, and all knee pain was gone again.
That's awesome.
It's gone.
Yeah.
And if I feel like it starts to come back even a little bit, I pump my Cataplex C back up to 12 a day, and within a couple of weeks, it's gone again. So I know that I have a propensity towards burning through my C's. And that has probably been my whole life. I've done some of the nutritional genetic testing. I do come back with some anomalies in my genetics where that is a problem for me. And that makes sense to me also. So that's just another layer in this whole puzzle that's been unraveling. Now I'm 53 years old, and I'm still unraveling the pieces of me that cause that problem, but also to make sure, guys, I've had a second lease on life.
Yeah.
I got to see my son grow to be a young man. I got to adopt another child. Oh, let's make that 2 children now.
Oh.
And I would have never been able to do any of that without this total change in lifestyle and approach towards medicine. My husband wouldn't be an upper cervical chiropractor and a darn good nutritional doctor if I hadn't had the experiences that I had that drove this path that we're on.
What got you into chiropractic, Dr. Chris?
Well, when I was a kid, I saw a chiropractor to get me through football, and that was very musculoskeletal. It was a typical sports chiropractor. And he told me when I was like 14 or 15 that I was going to be a chiropractor.
Oh.
And I always said to him, no, I want to be a football coach because football was my first love. So I went to school. I got my undergraduate in phys ed, and I coached football for, 8 years? And then Melissa got sick.
Yeah.
And learning all the stuff that I learned and reading all the books that I learned, I said to Melissa one day, it's time to be a chiropractor.
Wow.
And she said to me, you're a phys ed teacher. You're not smart enough to be a chiropractor. So I started looking at schools. And
Thank you.
I found out I had 4 or 5 prerequisites that I had to accomplish in organic chemistry and physics. So Melissa said to me, if you can do these prerequisites and you can do well, then we'll talk about chiropractic school.
And this is like a year after we meet this natural doctor who's got me on this path to 100% recovery, right?
Yeah.
So I got some mind back in me
Yeah,
again.
yeah.
I'm feeling my oats a little, and
This
I'm
could
telling
be
him,
the path.
I don't know if you can do that.
So I did night school at UMass Lowell, and after work every day, I'd drive down and take my classes and ended up doing pretty
Did you
good.
pass?
He got all A's.
I got all A's.
Got all A's.
I did too.
Yeah,
Yeah.
Once I decided to go back to school, I had a couple of prereqs to pick up. Straight A's.
Well, she thought I was stupid because all I wanted to do was throw a ball to kids all day.
Well, there's-
and
I'm
that's
with
all
you,
I wanted
girl.
I
to
can
do.
relate to that.
So I didn't need good grades to do that, right?
Yeah,
So
yeah.
as soon as I had that passion and that obsession with learning as much as I could, I was into it. I was all in.
Man, I woke up kind of half awake this morning. I woke up and I said, man, is there any college football on today? No, it's another month yet.
Well, I want to just emphasize, too, to help people out there listening, we're talking about a weird product name. It's called Cataplex C. It's a standard process product. Cataplex, I don't know why Dr. Royal Lee named his product this, but I think it's like a catalyst.
Well, all the cataplexes in the standard process line, that's kind of like Dr. Lee's name for whole food vitamin, nothing missing. So if you, that's why there's a Cataplex A and a Cataplex C and a Cataplex B.
So the Cataplex C is our vitamin C.
That's right.
But it's not ascorbic acid.
Well, if you read the label,
foods.
you're going to see a whole list of foods on there.
Yeah.
If you go into Walmart or any of the big box stores, into their so-called nutrition department, you're going to pick up vitamin C. It's going to say ascorbic acid.
Right. In Cataplex C, there's 17 milligrams of ascorbic acid that's naturally occurring, but there's 325 milligrams of the whole vitamin C complex.
Right.
All of the factors.
You know, my dad was a dentist, and he's a really good dentist, I think, but it's all these years, and he was a smart guy. I mean, he was an anesthesiologist, too, except for he wasn't called that, but he did anesthesia in the hospital for years. But with all the periodontal disease that I watched, these patients walk through that office, and I'm like, how did he miss this? He read everything. He could get his hands on. How did he miss Dr. Royal Lee? How did he miss whole food? How did he... That's a great question.
He
had to have read a study where they took vitamin C and it didn't cure the scurvy. I mean, how do you not put the two and two together? I guess, you don't know what you don't know, but once you finally learn that, it's like, how did I not know about this? And that's one of the passions for starting this podcast, because people just don't know.
So this natural doctor got you on the standard process.
The natural doctor actually did not get us into standard process.
How did you find that?
We found that through chiropractic school. And so we were at Palmer College, and there was a standard process study group, and a fine gentleman, Hugh St. Ange, used to come to the college, and I was working full-time putting Chris through chiropractic school. I worked for Mid-American Energy. I had a 50-hour-a-week job, but when there was a study group, I was there.
Aww.
When there was Lyceum, I took vacation time because I was just loving...
Sucking it in.
Mm-hmm.
Well, you're an incredible teacher. I learned so much from you. Like I said at the beginning, there are mentors. And I go to your seminars, Melissa, and I'm just blown away with what you've learned. But now looking at this history, you can see why it would become a passion.
So how are you now? What's your day consist of now?
Well, I'm raising a 3-year-old, so my day is pretty busy from start to finish. But I wake up pretty energized. I pull a full load all day long.
You work so hard.
I work really hard. I have to raise a family. I run 2 businesses, and I spend a lot of time counseling patients. I'm a nutritional counselor, so I spend a lot of time on one-on-one FaceTime with people. So I have...
Let me interrupt you. Do you ever run across anybody that's suffering as bad as you are?
I haven't had anyone suffering as bad as I was. I can't think of a single patient. Can you?
No, not that have come in as bad as
right.
her, but a lot of beginnings.
The beginnings of it, and you know what to do now.
Yeah.
Right.
And
right.
if we knew then what we know now, she would have.
It would have been a totally different
history.
history.
She would have never had surgery.
Well, and the autoimmune component of these things. When you go to see a medical doctor, there's a lot of things that are talked about in terms of this disease.
Yeah. One,
it's stress related. You're type A. You need to calm down. You need to not be so stressed out all the time. So that's one of the first things I heard at 24 or 5 years old.
I hate men that say that when you've got little babies running around. It's like, what?
So, but stress does cause flare-ups.
Of course.
Sure.
It's fight or flight syndrome.
It changes chemistry.
Right.
It changes the body's chemistry.
There's the history of your food, your diet, your lifestyle, your trauma, and the drugs that you've been exposed to, specifically prescription drugs that totally mess up your digestive system.
The antibiotics.
Yeah. So there's that as well. And so now when we get to work with patients, and we do have a lot of digestive patients, I mean, most of us in this natural medicine realm see a lot of digestive patients.
Mm-hmm. Oh, we certainly do.
Mm-hmm. When we get a chance to work with them, it's identifying whether something is truly inflammatory in terms of a bowel disease, or whether it's more of an episodic type of situation, whether there's been some type of insult that's caused this illness, whether it's been travel out of the country, or whether there's been an exposure to an infection, or whether there's this antibiotic component.
Or
if it's transitory and it's not.
There's some investigative work
chronic,
that needs to happen in order to figure that out. It's not one answer for everybody. And so those protocols that are dealt out to the patient, require a little bit of investigative work. But what I do love about the standard process line is that it is rich in products and ingredients that will affect the digestive system, and not just cover things up and give a Band-Aid, but truly heal the tissue.
That's why I like the Zymex and the lactic acid use wafers.
Dermatrophin pH.
I was going to ask you if are you always on dermatrophin?
I go on and off almost all year. On and off all year. Mm-hmm.
Let me ask you this, because we're kind of coming towards the end here. Had you known then, as a doctor of upper cervical chiropractic, and you, Melissa, with your incredible and fathomable knowledge, then what you know now, what would you have done different?
Oh, a lot.
Squirted that chlorophyll.
Yeah. Well, chlorophyll would have been one to heal the lesions that she had.
And taking it internally because...
Both ways.
Because
are you looking for a protocol?
This
I think
what we would do?
I think maybe
call
a
our symptom
protocol.
survey line.
So based on what she
calling
had,
theirs.
number one thing, knowing what I know now, Cataplex C would be
Absolutely.
at the absolute critical.
I just got a whole new bottle of it today.
What about Cyruta Plus?
Cyruta Plus would have been there in the beginning.
Would have helped to heal the microvasculature.
It's got that rootin'.
Cataplex, not Cataplex C2.
Dermatrophin PMG would have been right in the list.
RNA.
E3.
Ochrapepsin.
Ochrapepsin E3.
Yes,
oh, yes.
Because of the amount of mucus that she had. So here's kind of what happens. Vitamin C, the vitamin C deficiency creates ulcerations in the large intestine. The body sees that as an irritant. It lays down extra mucus to cover and protect that from the fecal matter going through the intestinal.
Sure.
Right.
It's good, but then it's bad.
So you have to strip out all of that mucus with the ochrapepsin E3.
Yep.
That strips out the mucus.
The ochre is really sticky and it sticks to the mucus, and the pepsin eats it away.
Eats the mucus away, and then the chlorophyll would then be able to bond
Soothe.
to those and soothe the ulcerations, while the Cataplex C is actually fixing the genesis of the blood vessels rupturing.
And then there's
throw
always
in Protofood.
And Protofood for sure, especially with the emaciation that I was having because of the autoimmune
Super
thyroid
EFF.
disease.
Yeah, we've talked about Protofood before, but what we're talking about here, everybody, is the essential amino acids that are absolutely necessary in a pristine condition to rebuild the protein structures of the wall of the gut as well as the rest of the body.
The digestive cells flip pretty fast if you have good raw materials going in.
Yeah,
so,
every 3 to 5 days, the wall of the gut's different.
Right.
So if you have good raw materials coming in, you can change a disease process, a digestive disease process pretty quickly.
Something I've often talked about here, everybody, is that, what you're eating right now, your food, actually, when it breaks down and it gets absorbed in the blood, talks to the DNA of your cells. There is a communication, an energy level or whatever else. And what is being discussed with the DNA of your cells right now, and I know this sounds a little woo-woo, is what you ate the last 24 hours.
Ooh, we just had salmon.
That is the instruction that your DNA is getting. And so that's why the kind of diets that are conducive to good gut health are absolutely essential. Because you were talking about 2 liters of pizza a day. Pepsi.
Oh, yeah. It was a bad thing. But I didn't know better.
Well,
I honestly didn't know
none
better.
of us do. I didn't know either till I finally learned,
Yep.
The truth of the matter.
That's why, when working with patients, obviously we have to give people good counsel. But you also have to meet people where they are, where they've been, what their history was, and why they've gotten to this point. And some of us just never had the right upbringing in terms of nutrition.
Yeah.
Our parents gave us values, they gave us love, but they did not give us good nutritional coaching.
Yeah.
And the problem in the medical arena right now is that these poor fellows and girls, bless their heart, simply are not taught this information.
And they don't think food really is a trigger for disease.
I remember talking to my brother, who's a medical doctor, and I would say, how do you think we heal? I mean, we're not plugged into the wall, because he would literally say to me, food has nothing to do with healing. And I'm like, I mean, there's no words.
Heard that over and over again from these doctors.
You just want to shake them.
Heard it over and over again.
He's a smart guy. I mean, just like my dad. And
He's the past president of the Utah Medical Association and the past medical director of IHC.
Food
and he
has
says
nothing
food
to
has
do with
nothing to do
healing.
with healing.
Well,
See
you know,
that?
when our son was in the ICU, you'd go into the room next to his
This is a
room,
good story.
and literally on the wall, I have pictures of this in my book, that says the
Nutrition
Center. Literally a
On the
plaque
door
that says
going in
Nutrition Center. You walk in, there's two big, huge Slurpees going 24
Icy
hours.
machines.
Icy machines, 24 hours a day. And they emptied out. I mean, there was a new flavor every day. It was crazy.
Yeah.
And then the cupboards were full of cold cereal, and not good cold cereal, mind you. Lucky Charms, everything. The freezer was full of those high fructose corn syrup pops, those horrible
This is their
blue and red
understanding of
pops.
nutrition.
Well, you know,
This is their nutrition center in the ICU, where they should have bone broth and kefir and, raw
It's
milk.
kind of like the cart they push in when you're going through chemotherapy. I mean, that cart has everything that you should not be eating when you're going through chemotherapy.
Everything. And, I went and talked to that's terrible English. I talked to the dietitian there. And because I had to get everything past them. It was crazy, all the bone broth and everything I was bringing in. And I brought in some kefir. And she looked at that and she goes, oh, that's good stuff.
Well, if they think that nutrition doesn't heal you, that's the reason why they don't think nutrition hurts you.
Well, that's it. And they also know,
I mean, if
they know
nutrition has no bearing on your health, it also has no bearing
Eat
on
whatever
your
you
disease.
want.
they know that a vitamin B1 deficiency leads to beriberi. And they know that a vitamin C deficiency leads to scurvy. But they don't know that a lot of vitamin C will cure scurvy and a lot of vitamin B will cure beriberi. And I could go through every other vitamins and show their relative impact on human nutrition and healing. But they don't understand that large volumes of these things, the deficiencies that led to the disease, they never consider the fact that a mega dosage of this will actually turn it around.
Mark Anderson, the president of Standard Process West, gave an incredible, I don't know what you want to call it. I don't want to degrade it with a talk, but just incredible about how we used to cure things in this country. We used to cure beriberi. We used to cure these things, and it's not even discussed anymore. We can't even use the word cure, because it's a legal word. It's not an actual healing word anymore. And so we just manage symptoms, and it's right out there in the forefront. I think 20 years ago we would have laughed. Really, doc? Really? You're just going to manage my symptoms? Really?
Yeah.
You're not going to really try to cure this? And they would go, well, of course we're trying to cure it. But now they just come right out and say, we're just managing the symptoms.
Well, Business Week magazine did that article on how healing people is a bad business model.
Yeah,
it is.
Well, speaking of that.
We have gone on for an hour.
Yes, and I want to bring up our free symptom survey that we offer on our homepage at forbiddendoctor.com. This is where you go to get a protocol like we were talking for you. What would be the things you would take if you were coming to us for a protocol? And those would be some of the things that I would throw in there. I would also throw in, by the way, Super EFF.
Right.
Which I'm sure you probably have
Yeah,
taken.
and it's the most comprehensive survey you're ever going to take. It has tons of questions. And after you're done, you have the opportunity for a free 30-minute phone consultation.
And you'll be given a personalized protocol, of course. And that saves you money in the long run because you're not spending money on things you don't need. So, and also remember, your patronage of these offers keep this podcast on the air. So we appreciate
symptom
it.
survey is absolutely free at no charge to you.
So is there anything else we can recap
anything
with?
you wanna-
What's your best advice for somebody out there with ulcerative colitis? They're scared to not do their not that they shouldn't do their take their doctor's advice.
No, we never
but
say that.
What kind of healing things would you give them comfort and, barring, a full consultation with you?
Well, coming through all of this and then being 27 years outside of the surgeries and the healing component of that.
Oh, you're on the other side of it.
I'm on the other side of it. But, age is starting to happen now. And I have to still watch the absorption of nutrients. I have to make sure that my diet is dense. People don't stop oftentimes to think about that because food is easy and, you do it for a variety of different reasons, energy and feel good and all that stuff. And so I think a lot of people who have these inflammatory conditions need to understand that there are foods that antagonize that inflammation. And then there are nutrients and supplements and things that you can get, whole foods that you can get through counseling with someone like yourselves, to be able to do that will bring down that inflammation and heal. And so what I would say is whether you're suffering with the ulcerative colitis now and looking for other possibilities, whether you've gone through similar situations that I've gone through with surgery to save your life and then you're figuring out how to get the quality of your life back, or whether you are just someone who has a hard time staying on top of your nutrients. You tend to go anemic, you tend to have problems. Either way, all three of those stages of inflammatory processes related to the gut, they need care.
Yeah.
And for someone like myself, I need care for my whole life. I need to have solid raw material nutrients for my whole life because I will always have a hard time absorbing things.
Would you tell our audience for just a few seconds here, what do you mean by solid nutrients?
Dense.
So when I'm talking about someone like myself, I never go off a supplement protocol, ever.
Yeah.
I am always working on stuff.
Yeah, me too.
And so, when you have had chronic illness before, when you've had organs removed, you have to always do more than the next person. So even when I'm feeling good, I am on a protocol.
Yeah.
And so I want to impress upon people who have had these illnesses and diseases, you never stop improving on your baseline health. So that means taking a good, solid, whole food multivitamin, making sure you're getting your fish oils in, make sure you're eating a low sugar diet because that's going to increase inflammation, making sure that if you do have a hard time still digesting things, you soak your nuts, you cook and stew things, you do things to get good whole foods in it. You
eat raw eggs.
And you eat at home as often as possible.
Yeah.
So those are like the big things.
And hopeful, and something to end a little hopeful, your body is set to repair and restore. It's not set to degenerate. So it's amazing to me you've lived through that. Talk about your body is set to repair and restore. So it's so hard to eat well. If you can help it out with some whole food supplements, I think it's critical. You saw my box right there.
It's health insurance.
Yeah, that's what I carry around with me all day long.
She carries it around with her.
I literally go out on the deck with it.
She goes from room to room, and she takes that box of supplements with her.
I'm a crazy person, but I'm always doing a protocol and literally something specific that I am really concentrating on. And you saw my bathroom and by the side of my bed, and I have standard process everywhere.
That stuff on the shelf down right below where we were
and
at
right
is mine.
here.
But I cram mine down in the morning. If I don't take all my stuff in the morning, I don't remember.
Yeah, so I don't
But
think
I
that's
take
the
it.
best thing, but
And
it's
I
okay.
know how I feel when I don't.
At least you do.
Yeah.
Okay, well, we better wrap this up. Also, remember, you can always call our office at 801-523-1890, and they can help you with anything. You can, if you want to take the symptom survey, but you're not very computer savvy, just give us a call. We can help you walk through it, or we can actually do it over the phone, too. So the statements made in this podcast about specific products have not been evaluated by the United States Food and Drug Administration and are not intended to diagnose, treat, cure, or prevent disease. All information provided or any information contained on or in any product label or packaging or this podcast is for informational purposes only and is not intended as a substitute for advice from your physician or other healthcare professionals.
Oh, good job, baby.
Thank you for listening to this Forbidden Information and our Forbidden Podcast. Join us next time for another in-depth discussion of forbidden knowledge, and we will see you then.
Thank you for listening to the Forbidden Doctor Podcast. If you are curious about long life energy enzymes or ageless thyroid, you can purchase them without a membership from our website at forbiddendoctor.com. Or get our enzyme formula from Amazon.com by searching the full term, Long Life Energy Enzymes. Don't forget to take our obligation-free symptom survey to get a free personalized supplement protocol recommended for you by Dr. Jack, Mary, or one of our qualified nutritionists. Take the survey, get a call from our nutritionist to create a protocol and a patient login, then use that login to see your own personal protocol along with any favorites you've saved from our symptom library. Remember, our website and our clinic are here for you always.